Hi, welcome back. Here I am with an important topic of discussion where airway loses to circulation and maternity. We are going to discuss this concept maternity point of view. So here there is a Nclex priority where there is a full turnover where the circulation is beating the airway. Normally in Nclex, always we think airway, breathing and circulation. This is the pattern which we follow. But in obstetrics, some situations are in circulation emergencies where treating bleeding saves both mother and the baby, even if the airway looks very much concerning. So this is how we are going to master, and we are going to see the important things which is concerning in this particular topic. Here we are going to see some situation where the circulation comes first priority. First one is the postpartum hemorrhage. If the patient has a heavy vaginal bleeding, a boggy uterus, a falling BP and a tachycardia, the priority is to control the bleeding immediately and massage the uterus and give the IV fluids. This is most important. Even if the patient seems anxious or he is having mild breathing complaint, but the scenario which is most important here is because the patient is having hemorrhage which kills faster than an airway compromise in this scenario. So the next important point is placental abruption with shock. We have to identify the signs of placental abruption where we can see the vaginal bleeding or the concealed bleeding, where the patient is having the severe abdominal pain associated with hypotension and tachycardia. The priority action what we can do is we have to treat the shock, especially so as to give the circulatory support by giving IV fluids. We have to supplement with oxygen supply, and emergency response has to be activated in such type of case. Next important aspect which can cause the circulatory problem is the ruptured ectopic pregnancy, where it is being manifested by sudden abdominal pain. The patient might have a sharp shoulder pain, hypertension and fainting. So the priority action what we can do is rapid circulation stabilization. There is no other important thing other than the circulatory support. Mainly we have to master by giving IV fluids. There is nothing which is important like education or the pain control. So it is like we have to resuscitate the patient with IV fluids and the blood components. The next important aspect of circulatory problem is the uterine rupture, where it has been manifested by sudden severe pain and loss of a fetal station when we are palpating by upper abdomen, and we have to see for maternal hypotension,